Hi, we're group 12. My name is Anna. We have Amber, William, Serena, and Steve. We're going to be talking about nationwide nursing primary care provider shortage.
Introduction. The history of the nationwide nursing and primary care provider shortages in the U.S. has multiple facets. The U.S. is projected to experience a shortage of 124,000 physicians by 2034, primary care physicians accounting for 48,000 of those. Current primary care providers to patient ratio is 1 to 2,000. 96 million may be affected. Shortage of 1.1 million nurses by the end of 2022. Historical background. Post-World War II, the increasing complexity of healthcare and advances in medicine led to greater demand for nurses. Medicare and Medicaid in the 1960s further expanded access to care, increasing the need for healthcare providers. Aging population. Baby boomer generation ages, demand for healthcare increases. Demographic shift puts additional pressure on the healthcare system, and the primary care and geriatric care are experiencing higher amounts of patients. Educational bottlenecks, nursing and medical school limiting students' capacity, lack of faculty, clinical sites, and funding, restricts number of new nurses and physicians. Historical background continued. Changes in healthcare delivery, medical graduates opt out for specialty fields, better work-life balance, higher remuneration in specialties, technological and regulatory changes. Technology and regulatory environments increase complexity, requires continuous education and adaptation by healthcare professionals. The COVID-19 pandemic exacerbated existing shortages, adding stress on the healthcare system. Critical need for robust and resilient workforce. The counter argument for the lack of moral and ethical standards. Money can be seen as the primary issue in healthcare. Lack of moral and ethical standards allow greediness and profits. Need to expand number of nurses and primary care providers. Need to lower patient to provider ratio. Advocacy for ethical and fair treatment, not practiced by financial controllers. Universities affect amount of student debt for nurses and primary care providers. Methods to lower costs for primary care providers and nursing programs. For-profit hospitals are now investor-owned chains. Focus on wealth. Should there be promotion and preferences for non-for-profit hospitals?
Healthcare agency and organization. The American Nurses Association, ANA, was established in 1896. There are approximately 4.2 million registered nurses in America that are part of the ANA. And the main focus of the ANA is to advance the nursing profession, maintain high standards, and allow a safe work environment where ethical treatment of the patient and the nurses is available. The ANA was involved in different advocacy issues such as COVID-19 and is still involved with short staffing and addressing that issue, which is involved, of course, in the safety and effectiveness of healthcare in America. The American Nursing Association is specifically involved in the management of nursing shortages. This was crucial, of course, during the COVID-19 pandemic, and will be in the future as well. Policy influence involved in the nursing field is part of management and leadership. Dealing with those issues and bringing them to legislation is something that is needed in this case, and the advocacy for this is also needed. Education in nursing is also important to develop and retain nurses, and research and data trends involved in all of this is also part of understanding what can be done in the future to help these aspects within the nursing community.
Healthcare agency and organization. Association of American Medical Colleges, AAMC. President and CEO, Dr. David J. Skorton. Established 1876. Membership represents 154 accredited U.S. medical schools and 17 Canadian medical schools. Approximately 400 major teaching hospitals and healthcare systems. The Department of Veteran Affairs medical centers, and 70 academic societies. The mission: The AMC leads and serves academic medicine to improve the health of people everywhere. A healthier future through learning, discovery, healthcare, and community collaboration. Management of PCP shortages. Innovative approaches. Advocate innovative solution for shortages. Utilize technology and exploring new models of patient care. Addressing systematic challenges. Address systematic challenges in education and delivery. Reform that ensures sustainability, accessibility to healthcare. Policy advocacy. Increase federal funding for graduate medical education, GME, and expand the number of residence positions in primary care. Work for data analysis. Data and analysis on medical education pipeline, medical workforce, and medical school trends. Education resources. Support schools, hospitals in developing curricula and programs, and to encourage careers in primary care.
Ethical leadership involves integrity. Dr. Grant is a great example of that. He's been involved in various aspects of the nursing healthcare system. He led the system through many challenges during the COVID-19 pandemic, such as staffing crisis, severe burnout, workplace violence. He also addressed guidance and facing other challenges during this time. As a whole, he was able to lead us with justice and fairness involved in his choices, and his strong moral and ethical codes are what he used in being able to achieve this. Transformational leadership involves a visionary. Dr. Grant was a visionary. He was able to enhance the already put in standards of nursing and advocate policy change. He's been inspirational. He uses an engaging and uplifting style of communication to be a transformational leader. And he's also been involved within the racism and injustice that can occur within the nursing system. And he's been an advocate for more inclusive and just healthcare systems.
Emotional intelligence, empathy. Dr. Skorton demonstrates a deep understanding of challenges faced by medical students, educators, and healthcare professionals, crucial for his position. Self-awareness. Career progression from cardiology to academic leadership indicates AAMC's high level of awareness and adaptability. The AAMC also spoke on the significant legal ruling affecting academic medicine in the Supreme Court's decision on admission process to higher education, reaffirming AAMC's commitment to diversity, equality, and inclusion in the face of challenges. The AAMC engages stakeholders in academic medicine, including medical students, residents, and community leaders, addresses issues like racism, and emphasizes the importance of social determinants of health.
Dr. Grant and Dr. Skorton are actively involved in being vocal to the public, state, and federal legislators, in addition to influencing actual legislation and policies to solve shortages and protect healthcare employees. We're unable to locate negative traits between these two leaders. However, the negative traits we found are in upper, mid, and lower level management and the hostile work environments they create. For example, centralized decision-making is a common practice among the CEOs of several healthcare companies. They often make important decisions that will affect hospitals and its employees without consulting department heads and team members. They also limit input from medical professionals who have specialized knowledge or insight, which potentially impacts patient care. One solution for this problem is fostering collaboration between the CEOs, doctors, and nurses. This can enhance their sense of ownership and commitment to these outcomes. Negative traits. Research by the JLD Group indicates that at least 50% of organizational leaders today display negative traits that cause stress, pressure, and poor performance among their employees. Although negative characteristics may deliver immediate results initially, these behaviors are not sustainable and are obstacles to achieve long-term values and needs. Positive and negative traits determine how well or poorly values and needs are met. Successful leaders must limit the negative and develop the positives. In conclusion, the issue of mass shortages of healthcare workers continues to be a complex problem rooted in several critical areas: abnormally expensive education, increasing healthcare needs for aging population, evolving specialized care taking away primary care providers, as well as overworking existing employees, causing career shifts out of the industry. Solutions are continuously being developed. However, our government and current policies move too slowly to solve this crisis effectively. Champions for our healthcare employees like Dr. Grant and Dr. Scorton continue to push for protective rights and fair treatment. It ultimately comes down to the influence of unions and our government legislation to change the future of healthcare. Thank you.